Okay. Well, I just learned how to say his name and I forgot already, but I'm going to try. Please welcome Christophe Joquet. Joquet, okay, welcome. He's going to be talking about why healthcare must catch up with innovation. Please, Jacques.
Thank you. Good afternoon. I see some familiar faces, but to introduce myself, if the slides come up, then I can briefly say that I am a keynote speaker, professional keynote speaker and author. I have a background in business and economics. I'm specialized in strategy, if you will. But I've been working for 25 years in healthcare. And today, I'll be talking to you about innovation and why we should actually innovate. This is me. I sometimes call myself a business strategist for a healthier future. Which means that I try to work with companies to make sure that they are focusing on the right stuff, to make sure that we innovate for a healthier, more sustainable future. And not do this only with healthcare companies, but also with non-healthcare companies. Because that's the core essence of everything that I do. There's one particular belief, and that is that health and happiness is important for all of us. Let me just quickly check in the room, is that who does not want to be healthy and happy? See, so pretty much everyone. And based on that, what I do is I try to look at trends in society, technology, business, and look at how that impacts our health and happiness. But I also do the opposite. I look at how we behave when it comes to our health and happiness, and how that influences, on the other hand, businesses and technologies. And with that, I try to come up with trends. I look at things that are happening in society, write a ton of newsletters on the topic, who eventually end up in books like this. My first book was called HEALTHUSIASM. Second book is just recently out. It's called Trends in the Transformation Economy. And so what it really talks about is the importance of health for all of us. And this is what I mean with healthhusiasm. I'll come to that in a second, but I'll also be talking about these transformations, because everything that we do in healthcare needs to be focused on transformations. But at the core, again, of those two books, there's one simple truth that I always say, is that I don't like the word healthcare. For the simple fact that it's too much an on and an off switch. We are sick and we get into the system. And then when we are less sick or we're no longer sick, we go out of the system. Is that healthcare? I think we take care of our health always. And that's why I talk about healthhusiasm. People have this aspiration to become healthy and happy. And this is what I always talk about. This is my core belief in everything that I do. And you may say, this is nothing new. I mean, people always wanted to be healthy and happy. Even 2,000, 3,000 years ago, I mean, people wanted to be healthy and happy. They brought offers to the gods. So what has changed? Well, there was a very specific period in time where things really changed. And that was during my childhood with this woman. Anybody knows this woman? Jane Fonda, of course. What happened is, if you lived that period, you might remember these papers on the walls, you might remember that kind of television, and you might even remember the videos that she put out. So what happened is that this was the first time that people were actually training, exercising to have an impact on their own health. Never happened before, because we came out of a period where cigarettes were sold like this, where actually you could buy bedside in a hospital still cigarettes, but as of the 80s, it kind of slowed down. People started having, or smoking less at least, right? And that was because we saw a lot of new diseases coming up. Cardiovascular diseases, cancer really exploded in the 60s, 70s, 80s. And so more and more people started taking action. It started with some public health initiatives in the 60s, but that wasn't really too successful. It really started when these workout videos came out in the 80s. Obviously, a lot of things happened ever since. If you see that healthhusiasm trend that I showed you earlier, the fact that people more and more are actively impacting their own health, or at least want to impact their own health, well, there's a couple of other trends that followed. Obviously, we have more information now available. We have Dr. Google, AI is coming very shortly, and most of the people really want to have an impact on the decisions that are taken about their own health. But there's also social media, of course. 40% of people that are on TikTok, they actually change their behavior when they're having a chronic disease based on what they see on TikTok. Medfluencers are the most influenced or the most trusted partners on these platforms. And finally, there's a lot of health tech out there. 1 in 3 is actually using a wearable already today. So what we see is that more and more people are actively involved in their health. And this is what I call healthhusiasm. And it even grew with COVID-19, of course. healthusiasm, the aspiration that we all have to be healthy and happy. And one of the main things that I always say if I speak to healthcare companies is that please stop saying that patients are no longer motivated. They are more than ever motivated in their own health. They're more than ever engaged in their own health. In fact, if you look at the self-care researches of the Google searches online, you see that it quadrupled in about 10 years between 2007 and 2017. To then again double afterwards. This is Google searches for the word self-care. A trend agency called Wunderman Thompson said that this super self is everywhere. Everybody wants to have an impact on their own health. And it has turned into an almost 5 trillion business today. 5 trillion business. That's 4 times as big as the pharma industry. That's twice as big as the whole world healthcare expenditures out there. This is how important it is to take care of yourself. This is how people go about no longer being reactive, but more and more becoming proactive in what they're doing. Nielsen, which is like the consumer version of IQVIA, if you will, said that 48% of people are proactively involved in their health. Now, a recent study by Lululemon, the yoga brand, identified that about 89% of people this year were more occupied with their health than the year before. This is how actively involved people are in their health. And so with this healthhusiasm, what we need to do, we really need to think about innovation and what can we do with this in healthcare. Because the time is now. I mean, our system is basically broken. And if you look at what's happening, we have on the one side, we have a lot of burnouts, right? Physicians who no longer have the time or the drive to even put time into their work. And on the other hand, we have long waiting times, months sometimes even, maybe even years for some in some disciplines. And so what we need to try to do is rethink of everything that we have in healthcare today. We have a lot of healthcare services, and if you ask me, they are terrible. They're too expensive. Very often they're not scalable, and they're also not a great experience or not engaging enough for patients today. So what I often say, and it's a bit provocative, but what I always say is that we really need to get rid of all healthcare services. We need to turn them into products because products are more scalable and less expensive. Or we can turn them into experiences, which then become more engaging and more, or at least a better experience. This is what we need to do, because if we really think about what it is that people want, is people want to be engaged. People are looking for that value that they want to get out of the healthcare system. And right now, we're not creating the right value enough. And this is what I really talk about in my last book. This is the basic of everything that goes around transformations. But it's really about how can you make the right value for your customers, your patients, your health consumers, whatever it may be. And I'll show you how you create value in the gym industry first. This is a halter. You can buy it for 20 euros, right? $20, whatever you may call it. And what have you, you can work out your entire life for 20 euros. That's about it. That's the value you want to pay for this. Now, if you go to a gym, they already bought everything for you yourself. So you are ready to pay more. You don't pay 20 euros your entire life. You pay 20 euros a month, right? This is the way that value is created in the gym industry. Now, what we've seen in recent 10, 15 years is that we saw spinning classes. Spinning classes are experiences, right? You sit on the bike, you high five, there's some loud music going on, some disco ball, whatever. Somebody's yelling at you. This is an experience that people are willing to pay for, not 20 euros a month, but 20 euros per session. This is how value is created. We go from products to services, from services to experiences. And that is the value that you create. And the more value you create, the better your engagement is with your clients. This is what we call the experience economy. And I really think that from a healthcare perspective, we need to think about that. How can we move away from these simple services and turn them into products? Or how can we move away from these services and turn them into experiences? And I'll make another reference to the gym industry. Look at this. This is a gym, right? How great of an experience is this? Makes me think of a hospital, if you will. It's not really engaging. That's why people don't like to go to gyms, basically. But if you have this, which is an experience, well, people are more willing to go there. That will be way more engaging, and people are even willing to pay more. This is what we need to have. Or the opposite, we go to a product. We try to bring the solution into the homes of people in a way that is more scalable and maybe even, less expensive if necessary. This is how we go about it. And I really think that the healthcare system, if we want to innovate, we need to think no longer in terms of services, but in terms of experiences and products. And so I'll go very briefly to both of these evolutions to showcase how you can do it or why you should be doing it. Very briefly about the products is that it is already happening. May sound, something new, but you might have heard of Forward Health, and this is Adrian Aoun, and he said literally, we need to turn healthcare, at least a part of healthcare, into products. And he did it with this kind of care pot where you can go in and you have an automated version of a physician. You can actually test a lot of things yourself. If necessary, there's a telehealth consultation, and he wants to bring it pretty much everywhere. It's a productization, it's an automation from everything that otherwise would be done by physicians. Philips is working on this. This is actually the same thing, but it comes to your house. It's a self-driving cab that comes to you to do exactly the same. Do the diagnosis, have a chat with a virtual physician, and so forth. Samsung is working together with Neon on this. These are digital humans who look like real humans and with whom you can actually have a first conversation if the physician is not available. It's a product, and it does exist already. WHO, NHS, or pharmacists in the Netherlands, they already have these kind of digital humans who can help you out today. Thinking about how can you turn certain services of healthcare into particular products, but you can also turn them into experiences. And so if you want to turn them into experiences, you need to realize that actually as a patient, we're only a very smart part of our day or even our lives a patient. And we have a lot of things that are happening in our lives which provide us lovely experiences. Now, what do these experiences bring? They generate certain expectations. And this is something that we often forget because really we need to understand what is happening outside of healthcare to be able to make the right experiences that meet the expectations of people. I'll give you a quick evolution of the banking sector to show how the experience changed in about 60 years. This was the yes machine in the 1960s. I mean, you didn't even have to go to a bank. You could just collect money there. It was the first time that it was self-service. A little bit later, what we had remote experiences. So you can call in to have some transactions done. You didn't even have to go to a certain bank to have some transactions done. You could do it over phone. And in 2000s, online experience. You could do some more stuff. Mobile experience. And we have wearable experience. More and more we go to conversational experiences where you can actually have a chatbot that reacts reactively to what you're asking them. And we're going really soon to this companionship. This is what's happening right now in the banking industry. It's an evolution that goes rather fast, if you ask me. If you look at the technology and the experiences that we are creating in a simple industry like the banking industry, which we all have to deal with. So the question is, where are we with healthcare? And where do we want to go? This is really what it's all about. And you need to understand that you have to meet the expectations of people as well. If you look at the healthcare industry, very often what we do is we see medical needs and we find a solution. And we say, here you go. And then if patients are not engaged, we say, well, look, he's not engaged, he's not motivated. But very often the reason is because it doesn't meet their expectations. Expectations that have been built by the experiences that they had in other parts of their life. And so if you really want to innovate in healthcare, if you really want to think about how can we transform healthcare in this time, which I call healthhusiasm, with this trend that is actually healthhusiasm, I think one thing is very important, is that we need to understand that the time is now because our system is basically broken. And in that system, we notice that the healthcare services that we are presenting today are very often too expensive, right? They're not scalable, they don't provide a great experience, and they're not engaging enough. So we need to think about how can we move into products? How can we make sure that we perhaps make things that require less engagement, but are also less expensive? How can we make sure that we bring that bicycle at home, that people are more motivated to actually do it, that we can reach more people? But at the same time, we need to think about how can we turn those services into experiences? How can we make it great again? How can we make it more engaging? And there again, think about the gym industry, if you will. Because if we create those spinning classes, people will be willing to not only pay more, but also will be way more engaged to come. Because that is the basic question that we need to ask ourselves. There's a lot of things that are happening outside of healthcare which changes the expectations of people because these experiences change. So ask yourself, on top of the need that you try to meet, how can you actually meet their expectations as well? Because that is essential if you want to innovate. And the time is now because we live in a time where people are more than ever engaged in their health. It is what I call healthhusiasm. All these tools that provide us more insights, more possibilities to actually impact our own health. 89% of people today are more occupied with their health than even yesterday or the year before. This is how important, this is the huge opportunity that we have. Because don't forget, we all want to be healthy and happy. My name is Christophe Choquet. I'm exactly at 0000, 15 minutes. Thank you very much. I'll be around if you still want to discuss some elements.
So thanks a lot, Christophe, for your energetic and inspirational keynote. So we got it. We got your message. Experience is, really the key factor to transform an healthcare system which is basically broken. So now I'm very excited to